Live to Queensland, where Stephen Miles is addressing the media.
Care. We are continuing to test over 3,000 people a day, in fact 3,224 in the last reporting period. We have now completed here in Queensland more than 150,000 tests. The fact that we continue to have that very low rate of cases and they continue to be largely people who have returned from overseas, again many of them off cruise ships, suggests that the first round of easing 2 weeks ago has not led to increased transmission, and that gives us great confidence going into today. The next round, that's step one of easing of restrictions, more substantial easing of restrictions. With regards to the case that we reported on yesterday, the nurse from the North Rockhampton Nursing Centre, our public health unit has been undergoing contact tracing. They have identified 42 contacts, including 39 staff and 3 members of the community. We've now tested 193 people, including 114 residents, the rest being staff and other contacts. All 193 tests have returned negative, which of course is the best we could have hoped for out of that batch of testing. However, everybody, including the residents, their families, the staff, the entire Rockhampton community, should rest assured that we are taking the risks here very, very seriously. We have a team of paramedics. They are briefing together at 10:30, and at 11 a.m. will be available to the HHS to transfer residents out of that facility. What that will allow us to do is to move residents from the Westwood Wing who are likely to be lower acuity, in better health than those in the Ivy Baker wing who we think may have been exposed. Once we have decanted residents out of the Westwood wing, we will be able to spread out the Ivy Baker residents, providing greater infection control, private rooms and en-suites. It is our goal to have that done within the next 24 hours. That team of paramedics includes 4 ambulance units, 2 patient transport officers and 2 supervisors, one to be based at the nursing home, another to be based at the facility where we will shift residents to. Our ambulance service is very skilled at this kind of work. They have a fantastic plan that is embedded within the HHS's plan to keep all of the residents and the staff safe. They have all of the resources at hand that they need to do this. As I say, they're likely to commence that at 11 a.m. today. I know there is a lot of interest in this matter and there is a lot of media at the facility, and I would just ask all of you and those who are there to be very sensitive to these residents, sensitive to their identity and their privacy as we attempt this important operation. It's important to note that these are all elderly residents, many of them frail. The ambulance officers will do this as sensitively as possible, and as I say, I just ask others who are there to ensure that they don't impede the ambulance officers doing their job. I'd ask the Chief Health Officer to add to what I've had to say.
Thank you very much, Deputy Premier. So another day where we've only seen one additional case. We are going to see continued cases going forward, so that's why it is so important that if anyone in the community is sick with any symptoms or fever or history of fever, to come forward and be tested. That way we can keep everyone safe. So we did see the nurse in Rockhampton come forward, but unfortunately after she'd been sick for a while. So it's important that as soon as you get symptoms, as soon as you feel unwell, please come forward. We have a lot of testing capacity in Queensland throughout the state, and we need to use that to its fullest so that we can continue to ease the restrictions that we've started to ease today. So it's great that people can get out and about now in larger groups that they can start going back to cafes and restaurants, to shopping centres. All of that is excellent, but we know that if we have one case in a community and we have got more movement going on in that community, we'll get a lot more cases. Till now, because of all of those very, very firm restrictions in place, it was very hard for the virus to get a hold. It is now going to be easier for the virus to get a hold, which is why we must all, every single one of us, all 5.1 million Queenslanders, must every morning when you get up think, have I got any symptoms? If you do, stay home and go and get tested. The reason I need you to do more than just stay home but get tested as well is because we know you can transmit this virus for up to 48 hours before you get symptoms. So even if you go and get tested immediately and you're positive, we need to go back 48 hours prior to when you got those symptoms. So that's why I need people to stay at home, to isolate themselves if they've got symptoms, but also to be tested. Thank you.
Is there a danger that lifting restrictions quickly could lead to more outbreaks? And what do you need to do to make sure you've got contact tracers and everything else to jump on those cases as they rise?
Right. There is a danger that if we lift restrictions and people don't come forward and get tested as soon as they develop symptoms, that the virus could take hold. I don't think that will happen because Queenslanders have done a fantastic job to date. They have really been very cautious and they have come forward in their thousands every single day to get tested.